Hi, in this section we will learn about renewals and soft stops and hard stops. Per Lourdes Hospital policy, CMS, and state regulations, antibiotics and controlled substances need to be renewed. Any controlled substance or antibiotic must be renewed every 7 days, and any PRN medication that's a controlled substance needs to be renewed every 3 days. And so in Cerner, you will note that you can do a renewal online pretty smoothly. So to demonstrate, I wanted to talk about this magnesium oxide order, this prednisone order, and this Norco order. And I wanted you to understand what is a soft stop and what is a hard stop. So first of all, we'll look at the magnesium order. Here under clicking details, you'll see that this is called a physician stop. This means that this order will be given until 8/2/2359, after which the order will automatically discontinue, and it will come off the MAR, and the nurse will not be able to give this med. So this is called a physician stop. It is called a hard stop. Basically, the order falls off the MAR at that specific stop date and time. The second one I want you to see is this prednisone order, which is called a hard stop, but there's also a time when it should be stopped. And so for this type of order, there is a renewal that can be renewed. So it says this order with this hourglass, it says this order is due to be renewed, and it will be discontinued automatically. So this is a physician stop that has a renewal ability to be renewed. So and then the third order to look at is Norco. This is a soft stop. Notice the hourglass doesn't have a little lockbox, and so if you were to left click on this under details, this is a soft stop. So the soft stop was entered by pharmacy. Usually any verbals or any written orders sometimes go through the pharmacy, and the pharmacy creates these soft stops. Soft stops mean that even after the order has the stop date, beyond the stop date, the order will still be on the chart, still be given, and the physician has 7 days to renew it. So in this case, 3 days, because it's a PRN controlled substance. So we should renew whenever we see these hourglasses. If it's clinically indicated, renew these orders. And make sure that we sign off on them. So to renew this physician stop, you would right click and click renew, and it's basically asking you renew for how many days, this duration field. So let's say I wanted to renew it for 7 more days. You could put 7 days and then click orders for signature and click sign. And so now you will have renewed the prednisone, and if you click refresh, notice the renewal has disappeared, that we've correctly renewed it electronically. The other one are these PRN meds that need to be renewed every 3 days. We need to sign off on them, and so if you right click on here and then click renew, it's the same process. It's going to ask you for how long do you want to keep this controlled substance, and you could say I want it for another 3 days. Or define the number of days, and then click orders for signature, and then click sign, and you will see that once you click refresh, that the hourglass goes away. And so these orders now have been successfully renewed electronically. Thank you.